Hi, I'm Tom Kelmer, the National Coordinator Tackling Indigenous Smoking.
Hi, I'm Damien Shen. I'm a Aboriginal Chinese man from South Australia, Ngarrindjeri descent, and there's nothing better to start the morning than a nice ride through the park.
I notice when I don't smoke, I feel way better, and just I could run for ages, my lung capacity is just excellent, when I don't smoke.
I believe it's the single most important thing you can do as a doctor. If somebody smokes, their health's not going to improve really till they stop smoking. So it is, although it's very simple, it's a very powerful thing to do.
Tell them the truth, and then leave it up to them, If they want to live, they'll try to give it up, and there's plenty of help out there.
Other people that look up to me in the community and stuff like that say, oh, you want to smoke? And they go, no, I don't smoke. Oh, you stopped, eh? Snowball effect. It's quite amazing how it really does snowball.
There's a whole range of risk factors, and as the National Coordinator for Tackling Indigenous Smoking, the workforce that I lead and mentor around the nation, and that's 57 teams of 6 people, are out there to look at probably the biggest impactor and risk, and that is the risk that that happens when you smoke. And so we look at trying to reduce smoking, or to reduce or stop people from taking up smoking in the first place. And we also look at the healthy lifestyle workers, look at behavioural change. How do we make people more healthy? How do we make people more active? How do we encourage Aboriginal and Torres Strait Islander people to go and get health checks? So hand in hand, we look at tackling smoking and we look at healthy lifestyle. Many people have asked me, why do Aboriginal and Torres Strait Islander people smoke so much? And I guess there's no one reason, but we do know that up until the late 60s, early 70s, many of our people were paid rations instead of money. And so part of that ration was tobacco. And so governments and employers and even church groups who dispense these rations actually created a culture of smoking with our people. And so we also know that people role model. And so if a young child sees an older person smoking, the chances are that they'll take up that behaviour. Then you get the peer group pressure. And so there's a whole range of factors, but it's often the factor of role modelling. When government or somebody gives you tobacco as part of your wage, you think it's all right, you start smoking, then people follow you. So that's one of the biggest reasons.
Hi, my name is Sean Appo. I'm the manager of the LIFE program at the National Centre of Indigenous Excellence. I'm a Kalkadoon and Garangarang man from Central Queensland, and I've been down in Sydney working mainly in Aboriginal community control health sector for a long time now.
Hi, I'm Nick Zwar. I'm Professor of General Practice here at the School of Public Health and Community Medicine at the University of New South Wales. I'm a general practitioner by background and now an academic, so very much working in the mainstream of the health system. Had a long involvement in tobacco control, particularly education for general practitioners and practice nurses and pharmacists and others about smoking cessation. And I've had involvement as well in Aboriginal and Torres Strait Islander tobacco use to do with developing resources for healthy lifestyle workers and tobacco action workers, and involved in some of the programs looking at how we might help Aboriginal and Torres Strait Islander people to quit smoking.
While there are 50% who are smoking, there are 50% who are non-smoking, but that 50% are sort of tied up in right across the age spectrum. There are still, you know, a lot of older people who are smoking, which in Indigenous communities, they're some of the role models for the younger people coming through. So that's where, you know, I think a lot of impact can be had with reducing smoking rates, is trying to do some work with not just the younger people so that they don't take up smoking, but some of the older people, to get them to realise how powerful that role modelling is amongst the community. Because that's where a lot of young people get their cues from. So those people who they look up to. You know, you don't see tobacco smoking as much on TV anymore. You might see it in a few movies here and there, and there are probably very little new celebrities, like a new style of celebrity, who will openly be seen smoking unless they're snapped by paparazzi or something like that. But you very rarely see that. So those kind of role models are sort of going away. But those community role models are still there, and they're still quite powerful. So I think a lot of work can be done in the community to try and get the information across to those people that, you know, this is having a real impact.
Well, it's also important for those people because we know that you know, that because the lag time, this is putting my biomedical hat on, the lag time between when you initiate smoking, where you get smoking-related disease, is, you know, 30, 40 years sometimes, so less in Aboriginal people, but a long time. But if you stop smoking, the health benefits are so rapid. You know, your chance of having a heart attack is halved within a year of stopping smoking. Your chances of getting lung cancer are dropping away, you know, quite substantially. Your chances of getting a stroke are, you know, 8 times less or something within 5 years. So, you know, for seeing people, older people, middle-aged older people, live longer, live healthier lives, for them stopping smoking is the biggest thing we can do for your health, as we know. But sometimes they think, oh well, it's the young people that are important. Well, they are, but they're important too. So that's another, you know, I guess a sort of a medical model spin on it, on what you're saying, but it's absolutely the case. And if we're going to see changes rapidly in rates of chronic disease, you know, heart disease, kidney disease, stroke, and you know, chronic respiratory disease like chronic obstructive pulmonary disease and lung cancer in Aboriginal people in the next 5 to 10 years, it's going to be mostly in people who are currently smoking, stopping smoking, as well as changing other behavioural risk factors. So that's a really great message as well.
For yourself, you've got to set realistic goals because, you know, it's not only a habit, it's an addiction. And you just don't give up addictions like that. So to break down that addiction, you know, for me, that was giving up smoking at work. It was my first goal. As soon as I get to work, no cigarettes until the minute I finish work, I can't have a cigarette. And then I said, okay, I won't carry cigarettes with me at all from the day I leave, minute I leave home till the minute I get home. And those habits, reforming those habits so that in the morning tea, you don't have a cigarette with a coffee, lunchtime, you don't have a break in coffee, afternoon, you don't have a break in a coffee. To get rid of them for me, that was a huge step. You know, because eventually, 3 months, 6 months down the track, it doesn't matter how long it takes, if you do that eventually, you won't have to have a cigarette from the minute you start work in the morning to the afternoon. You won't have to have one at lunch, you won't have it with coffee, you won't have it with food. Great.
With the messages and photos that they have on the cigarette packets these days, they send a huge message across, and a lot of the smokers, or the full-time smokers, don't really like to see that, you know, because they know that's going to be them.
It's a waste of money, and it's really killing. It's really killing you, smoking, and it was pretty hard, and it took me like 3 goes to quit. The first couple of times I used lollies and stuff like that. Then the last time I bought kilos of pears. I bought like 4 kilos of pears, and every time I felt like a cigarette, I just ate pears. Then after a while, I got over the cravings for it. And with nunk as well, I got into the patches. And then after the patches, I went cold turkey.
I feel a whole lot better. I haven't had a smoke last weekend, just haven't had a drink like for the last 2 weekends, I think, 2 weeks, yeah. I feel way better, yeah. Feeling healthier, and way fitter.
And I smoked from the age of 15, almost 20 something years, and just like I hate the smell of it. I hate walking in the cities and stuff because everyone's smoking a cigarette outside, and you can smell it from a mile away. And sometimes I used to walk around and think, I'm smoking walking, and how could that be healthy for you? It doesn't look right, you know, walking around having a cigarette. And you see people everywhere riding a bike having a cigarette. It's just like, yeah.
I only got one son that smokes, and I have a sign on my door, or not in the, I just bought a house, and I haven't put the sign up, smoke free. And my son that smokes, when he comes to the house, he looks to light up. I said, get outside. Oh, but Ma, it's cold. I said, well, too bad for you. You want to smoke your guts out, get out.
The best thing, I have taste buds now. I never had taste buds before, and I can smell. I never had the sense of smell because the cigarettes take that away from you. And I wish I would have done it 20 years ago. And I've got a bank account for the first time in my life. It's got a couple $100 in it.
I lost my grandfather from smoking, my grandmother from a stroke, cousins from heart attacks, uncles from heart attacks, and all from smoking. My auntie died not long after childbirth because she had pneumonia, heavy smoker. Lungs collapsed, it was all unpleasant. So that's why I'm in smoking. Some people ask me why I can work in smoking when I've never smoked myself, but I don't think you actually have to be a smoker to experience what smoking does to community, and that's why I work in smoking.
Be strong, believe in yourself, dare to be different and better your health. I said be strong, believe in yourself, dare to be different and better your health. My name is Duke Bailey. I am a number of things, direct care worker, a teacher's aide, a hip-hop artist, family man, Aboriginal man, South Sea Islander man, many things. But I see myself more so as just a role model for Indigenous youth. I've lived in the Inverell area all my life since I was about 2 or 3 months old. I started smoking when I was 7. I was influenced by some not so nice kids at school. They're a bit older than me, and they sort of thought it would be funny to see a kid puffing on a smoke. So yeah, my mate and I, we became the victims of that one, and I think I actually started drawing back the cigarette when I was about 10, and it all went downhill from there, and I became addicted by the age of 12, 13, and smoked ever since, up until about, I think I tried to give up 2 or 3 times. I gave up when I was about 16 for about a year, then fell back into the trap once again because all my friends had smoked as well, and family members as well, so it was a bit hard to escape it. Anyway, I took it back up, regretfully, and I became even more addicted, I guess, and sort of it didn't even enter my head that I wanted to quit again or anything like that. I just accepted that I was a smoker for so long, and that was all I'd known. But then I was given the opportunity to be a part of the Kick the Habit campaign, which I felt like I couldn't be a part of that if I was going to continue to smoke afterwards. So I sort of made that point in time was my decision to say, no, I'm just lying to myself if I keep going. So I can't be going out in the community and telling kids not to smoke and that sort of thing if I'm going to be a hypocrite and go and spark one up as soon as I'm finished. So I couldn't continue doing that. So I gave up for about 6 months after the Kick the Habit campaign, and fell back into the trap once again. And I didn't get off them this time for about, I smoked for close to a year, I'd say, and I've successfully quit now. Thank goodness. Christmas time, I decided that it was time once again to make the decision where boot the smokes for good. Be strong, believe in yourself, dare to be different and better your health. I said be strong. I guess keeping busy was one thing that's a really good deterrent. If you can keep your mind active, and whether it's with your work or just doing puzzles or games or whatever it is, and pretty much just, yes, keeping your mind busy. So if you don't have time to think about it, well, you're not gonna be tempted to do it, I guess. Be strong, believe in yourself, dare to be different and better your health. I said be strong, believe in yourself, dare to be different and better your health.
So Sean, I'm really interested to hear what you think of some of the strategies that are working, perhaps some examples of programs out in communities that are addressing tobacco smoking, but also other lifestyle issues like diet and physical activity. What to you are some of the standouts?
Yeah, I think through the Tackling Tobacco and Healthy Lifestyle national program, it's been quite interesting because it's been set up totally differently from other health programs delivered nationally. It's given a lot of freedom to communities and services to do things in the way that they feel would work. So it's using that community knowledge to develop their programs around those particular areas that they're funded to then tackle. And so whenever we meet up, and it's usually every year just before Christmas we'll meet up at a national conference, you have conversations with lots of people about what they're doing, and they really do come up with some interesting things. So using their local environment, using their local culture, using their local cultural protocols to develop information and programs and deliver them in a way that is directly targeted at their local people. And there's just been some amazing things that have come out, particularly around food and exercise.
They've done a bit of basis around the Jamie Oliver and the industry food stuff, and they've got
Good. Yeah, it's good, man. Very good.
Tobacco is still a really interesting one to try and tackle. There has been that myth for years and years and years that tobacco smoking is somehow a cultural activity that Indigenous people used to do, and it's not. There are very few Indigenous peoples and Indigenous nations that use tobacco in that way. I think where that confusion comes in is in that communal sharing aspect. So that's a really cultural thing with Indigenous people. So sharing tobacco and sharing a cigarette and having a conversation or something like that, that's where the sort of culture comes into it. So it's been sort of disentangling that has been challenging, but I think a lot of people have been trying to have that argument. I've heard people, and we worked on that NRT resource. When you talk with people, particularly some of the older people, about using NRT, they go, "Oh, look, I don't want to take white man's medicine." So you really need to think on your feet about how you tackle that argument. And some of the ways I've heard that tackled is that people will say, "Well, I don't know of any blackfellas that own a tobacco company. So, if you don't want to take a white man's medicine, then you're taking a white man's poison. So which one is going to help you live healthy?"
From my point of view, going along to some of the workshops that you mentioned, where the tobacco action workers and healthy lifestyle workers are getting together to talk about what they were doing, just great to see the enthusiasm and the innovation and how it really felt, and I think really is, growing from the grassroots up. It doesn't feel imposed or top down. People seem to be taking that opportunity and saying, okay, well, we want to address tobacco, but we want to address a whole range of issues related to tobacco, because you can't, just say this is only a smoking issue. And the innovation and the sense of ownership and and just people from all sorts of parts of the country doing interesting things.
So I'm going to tell you a few stories now, so you're going to have to listen to me talking about myself for a bit. And then I'm going to link it all back to this model called the innovation. I've been working with the Drug and Alcohol Services South Australia for the last 3 years as a Senior Project Officer, and my role is to coordinate social marketing across the state. So we do the marketing side of the anti-smoking messages. My interest in the marketing came from years ago when I left uni as an illustrator and sort of worked in the creative field for a long time. After that, I done a lot of stuff with the Aboriginal community, and then prior to taking this role for a couple of years, I was in a program called Do It for Life, where we actually worked one-to-one with community around different lifestyle chronic disease risk factors. So one of the main ones was smoking, so I got to experience what it was like to walk with people as they were on their quitting journey. So when we started 3 years ago, I was given the task of creating a campaign from scratch. And the main thing was, how do we start the conversation? This is something new. You can't just point your finger at people and tell them to quit. There has to be a way in to move people from being pre-contemplative to starting to consider how this actually affects them and their families. So the campaign is called Give Up Smokes for Good. It has a website, which is giveupsmokesforgood.org.au, or a Facebook page. You can just look us up on Facebook. We've invested so much time and effort and resources into creating this campaign. We've considered, I guess, the most difficult aspects of this campaign is how do you get the distribution of your message right to our audience.
I've joined a campaign called Give Up Smokes for Good that aims to reduce the harms to our mob caused by smoking. I'm one of 12 ambassadors helping to spread the word.
From our evaluation, we sort of can tell that the recall is quite strong, and we're getting a high acceptability of this the campaign in terms of being there, like from an Aboriginal perspective. People have to look at something and go, yes, this relates to me as an Aboriginal person and then as a smoker.
Now we're getting serious. So you've decided you want to quit? Well, here you'll find heaps of info to help you each step of the way. There are plenty of ways to quit smoking, so choose the one that's right for you. Just remember, every quit attempt you make brings you closer to giving up smokes for good.
People will start their journey in a whole bunch of different ways, and whether that's because they've had a serious health incident where they've gone to hospital for some reason and doctors told them to quit, or they've seen a poster of ours or multiple posters that start to trigger messaging. And one of the really strong things that we started to do was talking about smoke-free homes and cars. So it's like, okay, if you're going to do it, you just think about your family first, think about your kids, and don't smoke in your house, do it outside, or don't do it in your car while your kids are strapped into their seats and they don't really have a choice to escape that. So that for us was the first step in getting people to consider their own behaviour as part of their first step in their own journey, but also for us to then to progress our messaging further on to more sort of direct stuff about personal harms and telling people what type of support is out there and all that sort of stuff.
So let's look at ways in which we can get involved into the future to help ourselves, because governments can't make us healthy. Nobody can make us healthy. We have to make ourselves healthy. And this is what this series is all about, is how you can be strong to make sure that you address any chronic disease that you're likely to get, or hopefully, if you haven't got it, don't get it, because you don't want to get a chronic disease. Be strong.